welcome to our special session. My name is Nibedita Ray-Bennett. I'm an associate professor in risk management based at the University of Leicester, and Dr. Hideyuki Shiroshita and I founded the Avoidable Deaths Network. I would like to thank the audience and our expert panel for joining this special session. Today, the 25th of July, is the World Drowning Prevention Day. The theme for 2022 is Do One Thing to Prevent Drowning. In the spirit of doing one thing to prevent drowning, the Avoidable Deaths Network has decided to organize its special session, debut special session actually, on the future of drowning risk in the context of COVID-19 and climate change. So, Alex, can we move on, please? Yes, thank you very much. But if we could go back to the previous slide. So drowning is the third leading cause of unintentional injury death worldwide, accounting for 7% of all injury-related deaths, according to WHO. Although the global burden and death from drowning are experienced in all economies and regions, low and middle-income countries account for over 90% of unintentional drowning deaths. To highlight the tragic and profound impact of drowning on families and communities and offer life-saving solutions to prevent this type of avoidable death, in April 2021, the United Nations General Assembly declared 25th of July as World Drowning Prevention Day. This is the second year the member states and stakeholders are celebrating World Drowning Prevention Day, supported by the WHO. On this very special day, we have been very lucky to have 4 world-renowned epidemiologists and injury prevention experts. Dr. Olive Kobusingye from Makerere University, Dr. Aminur Rahman from the Center for Injury Prevention, Health Development and Research, Bangladesh, Dr. Colleen Saunders from the University of Cape Town, and Dr. Tom Makerere from Royal National Network concluded a research project on drowning in collaboration with University of East Anglia's Water Security Research Center. To present the findings of this project, we have Judy, Omasete. The expert panel will tackle some of the difficult questions of the second half of the 21st century, such as what is the future of this neglected area of public health in the context of ongoing COVID-19? Can the agenda of reducing these preventable deaths be kept alive as the low and middle income countries grapple with the recovery efforts from the impact of COVID-19 and economic lockdown? And finally, what is the future of drowning risk in the context of climate change and increasing number of climate-related hazards? We will also use this special session to present 2 posters developed by ADN's junior champion, Master Arkoneil Ghosh, and future leader, Ms. Racheal Nantume. Before I invite our expert panel, let me introduce the Avoidable Deaths Network, or ADN, briefly. So we can move to the next slide. Thank you. ADN is a diverse, dynamic, inclusive, and global membership network of experts, practitioners, and researchers interested in avoiding human deaths from natural hazards, naturally triggered technological hazards, and human-made hazards in low and middle-income countries. ADN was launched in 2019 at the 4th Summit of the Global Alliance for Disaster Risk Institutes in Kyoto in Japan. The next slide. We are often misunderstood as an NGO. ADN is not an NGO. ADN is based and led by the universities of Leicester in the UK and Kansai in Japan. ADN is actually a joint enterprise, and it is implemented in collaboration with regional coordinators across the globe. Leicester University offers flexible learning MSc in risk, crisis and disaster management, and I am the program director. And Kansai University offers BA and BSc in safety science. So to learn more about these programs, please feel free to visit our website or feel free to email me. So what is the purpose of Avoidable Deaths Network? So ADN's purpose is to inform policymakers, practitioners, and researchers to make better decisions, to save lives and reduce injuries, to achieve sustainable development. Our purpose is aligned with the United Nations Sendai Framework for Disaster Risk Reduction's first 2 global targets. So we can move to the next one. And target A and target B. The target A is about reducing the global disaster mortality by 2030, including drowning deaths during disasters. And target B is about reducing the number of people affected by disasters by 2030. Now, these targets work in alignment with several sustainable development goals. Last year, ADN has been selected to be part of the United Nations Sendai Framework for Disaster Risk Reduction's voluntary commitment platform. So we can move to the next one. So what do we do to achieve our purpose? So currently we are doing 6 interrelated activities. Given the constraint of time, I shan't go through the details of the activities that we do, but I think for this session, the first 2 activities are very important. Number 1 is fostering transdisciplinary ideas, partnerships, and solutions. And second is raising the visibility of these 2 targets through special sessions, which are delivered virtually and free of cost. We can move to the next one. So we launched the first special session on avoidable deaths on 4th December 2020 at the International Conference on Geographical Science for Resilient Communities at Makerere University in Uganda. Today's special session is the 10th special session, and we will deliver 3 more special sessions this year. The aims and objectives of our special sessions are basically twofold. The first is that they are knowledge sharing and engagement webinars. We deliver them virtually to the public for free with the aim to raise awareness on the concept of avoidable deaths and their avoidance through theoretical and practical solutions, sometimes both. Second, the aim is to raise awareness on those deaths that are often not in the mainstream. For instance, our previous special sessions have raised awareness on deaths from nutritional crisis, from dog bites, snake bites, scavenging. And today's special session focuses on drowning deaths. We can move to the next slide. Thank you. So you can join ADN. You can follow ADN through Facebook, Twitter, Instagram, LinkedIn. Also, you can look up the updates of Avoidable Deaths Network through the UNDRR Sendai Voluntary Commitment Platform. You have the link up on the slide. And also, if you would like to join ADN, we have the link there, and one of my colleagues is going to drop the link on the chat box. So thank you very much. And the next is that we actually capture the impact of our special sessions. So for this, we will run 2 polls, and we will launch the first poll now, and the second poll will take place after the last speaker's talk, and that will be after the Q&A that has been done. But before we start the poll, may I request Nimisha Goswami to take a picture of the special session. So if you could give us access to your camera, that will be fantastic. And after that, I will invite Dr. Hideyuki Shiroshita to run the first poll. So thank you very much for joining, and thank you very much for listening to me. So Nimisha, over to you.
Sure, if we can just minimize the screen or maybe just remove the screen for a while so that I can get a good picture. Thank you. Thank you so much.
Thank you, Nimisha. So Hideyuki, may I request
Okay,
you to
so
run the first
now let me run the first poll. Okay. Yes, now I think you can access poll. So this is very small survey, and the poll does not evaluate speakers, but our session. So this is mainly for our program. So So I'd like to wait until the response rate reaches 80%, but already 51%. So a few more, but I want to wait.
Hideyuki, I think because the number of participants is very low, so maybe we
71%. Are you okay?
participants.
What do you think? 71%.
Oh, we've got 71%.
Yeah.
So usually 80% is our baseline. So if you want to give a minute, so that's fine. You can make the decision.
We wait another 20 seconds. 30 seconds. Right. Okay. So yeah, let me end. Oh, yeah. Thank you very much for your participation, and let me share result. Now you can see the result of the first poll. So please remember, the result of the first the poll, and then yeah, we will compare the result of both pre-session and post-session, and we will evaluate, our impact special session. So thank you very much for participation. Right. Okay. Over to Nibedita.
Yeah, thank you very much, Hideyuki. So our first keynote speaker is Dr. Amin Rahman. It's an absolute privilege to have Aminur today to open the special session on this very special day. So Dr. Aminur Rahman is the director of the International Drowning Research Center. This research center is part of the Center for Injury Prevention, Health Development and Research, Bangladesh. In short, it is called CIPRB. Dr. Rahman has developed and implemented childhood drowning prevention programs for rural Bangladesh, and he is internationally renowned for his contribution in this field of injury prevention. So, Aminur Bhai, the floor is yours.
Thank you, Nibedita. Alex, can you actually start my presentation? Okay, thank you. So can you go to the previous one? The first one, the first slide. Okay, so the title is CIPRB's Leadership in Drowning Prevention and its Past, Present and Future Initiatives in Bangladesh. So I'll try to explain why I was labeling it as a CIPRB's leadership. Thank you. Move on to the next one, please. So if we see the milestones of drowning prevention in Bangladesh, it's not a very long ago. Rather, in last, if we calculate the 17 years we have been working it. Before 2005, nobody in Bangladesh were aware that drowning is such a big problem in Bangladesh. And from there, we actually started. So in 2005, we learned the magnitude and risk factors of drowning. And then from then, we started doing different research work to understand or identify the effective interventions. So since 2005 or 6 to till date, actually, we are continuing at different intervention programs. The first one you see, which was evaluated in 2010, was Precise. Then we did Bangladesh Racheal and Swim Safe program. And after that, we conducted saving of lives from drowning and was evaluated in 2015. And then from 2017, 18, and 19, we conducted our Bhasha. It's another drowning prevention research work which we conducted only in our southern district of Bangladesh. And Tom Mikro is from RNLI, who actually provided that we got the fund from RNLI. And from 2015, actually, during 2014, the identified interventions from Bangladesh were incorporated in the global report on drowning prevention of WHO. And various advocacy work actually started in Bangladesh, around Bangladesh, or in the other parts of the globe using Bangladeshi interventions. And the result of that, we got the UN resolution in drowning prevention. And that's why today we are talking on drowning prevention. And we are expecting that by this year, the government of Bangladesh, especially the Minister of Health, will finalize and publish the drowning prevention strategy for Bangladesh. And during this year, in 2020, the Ministry of Women and Children Affairs has taken the largest project in terms of money in Bangladesh. And probably it's not only in Bangladesh, the project size, probably in the globe. And that is, it's an integrated child drowning and child development project. So this is in short about the milestones of different drowning prevention activities and the results of those activities. Can you move on to the next slide, Alex? So we know the global magnitude, but many of you may not know the magnitude of drowning in Bangladesh. So in 2016, CIPRB, with the support of DGHS, did one of the largest survey in covering a representative sample of population of the country. More than 300,000 population we actually interviewed. And through that, we found that in Bangladesh, each year, over 19,000 people drown. Among them, 14,500 are under 18. If we calculate it per day, which is 40 per day. And if we consider under 5 children, that will constitute 10,000 per year, that is 30 children a day. So can you move on to the next one? Okay. Bangladesh Demographic and Health Survey, this is a government survey not done by CIPRB. We see that children 1 to 5 years, the number one cause of death in this age group is drowning, and 58% of the children of this age die due to drowning. After that, that is pneumonia or other intervention, other causes. Can you move on to the next? Okay. Why does children drown? In especially under 5 children, we found that about 2/3 of the drowning takes place either in the ponds or in the ditches. So, and these are not too far from the children's house. When does children drown? A child drown? Normally, it is in the daylight hours, from 6 o'clock in the morning to 6 o'clock in the afternoon. And more specifically, from 9 a.m. to 1 p.m., when mothers are busy with their household chores and father is out of home for work, elder siblings has gone to school. During that time, about 60% of the children drown. Can I move on to the next? And what are the factors associated with the childhood drowning? Bangladesh is the land of rivers. Several rivers intersect the country and their tributaries. And apart from the rivers, there are numerous ponds, ditches, and everything. And so people are very much exposed. Even the children are exposed to the water. And I mentioned that 80% of the drowning actually occur within 20 meters from the house. People are not much aware that drowning causes so much death. And there is lack of supervision, especially for the young children. And I mentioned that from 9 a.m. to 1 p.m., about 60% of the children drown, basically due to lack of supervision. There's lack of certain essential skills like swimming skills, rescue skills, first aid skills, and finally, even the hospital management of a drowning patient or a drowning person is not very satisfying. There is no structured protocol to manage a drowning case. Next, please. So in 2005, we saw this chart and actually understood that what should be done to prevent drowning. You know, when a child reaches his first birthday, it become vulnerable to drowning. So from first year of life is the most vulnerable time, and with the increase of age, drowning decreases. So about 80% of drowning actually happen below 5 years of age. But we can see that in other age groups, there is still some drowning. So, and we found that in a subset of sample, we wanted to know what is the extent of swimming ability of the children. And we found that there is a reciprocal relationship between the drowning death and the swimming ability. With the increase of age, swimming ability increases and the drowning rate decreases. And this actually gave us a clue that if you can teach children swimming after the age of 5 or 6, then a large number of deaths of children who are more than 5 years could also be saved, and children below 5 years need to be properly supervised. Next, please. So we did a lot of research from 2005 to actually till death. So it is hardly to remember to mention or difficult by this time to describe each and every research work. But I should mention the PRECISE, which was funded by UNICEF, SOLID, which the saving of lives from drowning has been funded by Bloomberg Philanthropies along with Johns Hopkins University. Bangladesh Atoll and Swim Safe project was funded by Canadian Grand Challenges Canada. Actually, I missed one, which is RLSS Australia also funded to work some of the drowning prevention activities. And finally, we are now working in Bhasha project with the support of RNLI. All these interventions suggest that children below 5 years should be kept in the atoll, and this is 80% protective, and children who are 6 to 10 years should be swim safe, which is 90%. Teaching children survival swimming is 90% protective. Move on to the next slide, please. So this is another, which is first responder training for the adolescents and adults, which we found that 90% of the community people can learn this skill and utilize during when it is required. Next one, please. So global involvement, you know, CIPRB has been involved in providing technical support to various nations to conduct national survey, including Thailand, Indonesia, Philippines, Cambodia, and recently India. We also provided support to the other nations like Vietnam and Nepal to implement the intervention. We had also contributed in knowledge sharing by publishing paper and also writing books, and also in the global report of drowning prevention. Next one, please. In the national level, we supported Minister of Women and Children Affairs. We are actually, this program has been recently launched, and also we CIPRB is supporting to develop the drowning prevention strategy to the government, and to some extent, CIPRB with RNLI is actually involved in this UN resolution on global drowning prevention. Next slide, please. So our future plan is to continue research to generate more evidence for effective intervention, capacity development in conducting research and implementing drowning prevention, provide support to government to scale up the drowning prevention program throughout the country, and strengthen national and international network for drowning prevention. Next, please. And that's all from my side. Thank you very much.
Thank you, Aminur Bhai. That was absolutely fantastic, the work that CIPRB has done. And I think you have encapsulated the trajectory since 2005 up until 2022 and beyond. and the evidence-based work, the interventions, the implementations and evaluation, and all of those coming to an informing policy level to influence not just nationally, but internationally. It's a stellar performance. So all the best wishes to CIPRB to continue shining globally. So our next speaker is, thank you, Aminur Bhai. So our next speaker is Dr. Colleen Saunders. So it's an absolute pleasure again to introduce Dr. Colleen. So Dr. Colleen Saunders is a senior lecturer in emergency medicine at the University of Cape Town in South Africa. She convenes the Scientific Advisory Board for Drowning Prevention with Life Saving South Africa, a non-profit organization. Her primary research interests are injury epidemiology and prevention, most specifically that of drowning, as well as research management and priority setting. So Dr. Saunders, the floor is yours.
Thank you so much for the opportunity to be here. I really do appreciate the invite. And I think this talk is really just to give a very, very quick look into how specifically COVID and climate change is likely to affect our work in drowning prevention over the next sort of future period. So because I think what we've learned since the start of COVID is that future casting is very difficult. I've specifically called my talk How to Keep Our Head Above Water During Uncertain Times. But if we could go to the next slide, please. I think many on this call will already know about the burden of drowning globally, but we know that about 90% of drowning deaths occur in low and middle income countries, and the African region in particular has very high drowning risk compared to many other regions. In South Africa, we have a drowning fatality rate of about 3 per 100,000. That equates to about 1,500 deaths every year. But we know that this is under-recognized because it doesn't account for transport-related injuries, it doesn't account for non-fatal drowning, which from other regions we know can be anywhere between 1 to 4 and 1 to 10 as a ratio to fatal drownings. And it also doesn't account for extreme weather-related drowning fatalities. So I think we recognize that drowning is a problem, but we certainly recognize that that the burden is much higher than the official numbers. And in my next slide, you'll see that South Africa has what we call a quadruple burden of disease. So we have these 4 kind of colliding epidemics. This is a figure that was presented by the South African Medical Research Council a number of years ago. But we have very high rates of infectious diseases, complications of maternal and newborn and child health, growing burden of non-communicable diseases, and then a very high burden of violence and injury. But even within violence and injury, the 2 main contributors there, which are interpersonal violence and road traffic crashes, both of those have rates that are about 10 times higher than the drowning fatality rates in South Africa. And so it's very hard to position drowning as a priority when you're kind of competing against these other quite big burdens in a bigger picture of healthcare burdens. COVID has had a very real impact on the South African economy as well. So we had a hard lockdown period right at the beginning of the COVID pandemic. And this had a huge effect on our economy. So much of our workforce, and we already had very high rates of unemployment before COVID, but much of our workforce was very casual labor that were not protected during this time. And so unemployment rates soared, poverty increased immensely, and we haven't recovered from that as a country. So what this has meant is that there is less money for investment in the private sector and in the public sector. There was obviously a lot of refocusing of budget and resources around the response to COVID, understandably. But even before COVID, we've kind of had this large competition for a low number of resources as well. And so drowning prevention tends to fall quite low on the the general resourcing agenda, and that's probably even worse now after COVID. If you move into the next slide. So what a weakened economy, one of the effects of a weakened economy is even higher rates of inequality in the country and poverty. So many of you, the figure on the top right, will recognize that from the cover of a Time magazine many years ago that shows the stark inequality in South Africa. And so you have green leafy suburbs with some beautiful blue swimming pools on one side of literally a road, and on the other side is an informal settlement with very high rates of poverty. Those are shacks, very high density, no infrastructure, no public services. And we are seeing more and more, you can go back, sorry. We are seeing more and more that the downturn in the economy has forced people into kind of more informal, high density living. And this has had a knock-on effect on drowning risk, but also on resources available to deal with drowning. And as we move into, well, not move, as we start to recognize the effects of climate change as well, we know that drowning is inextricably linked to development. And so the decreasing economy that has impacts on infrastructure and our ability to maintain it. It has impacts on urbanization, increased vulnerability of different populations, and obviously extreme weather events as well. And those extreme weather events impact these vulnerable communities much more than they do the green leafy suburbs of Johannesburg across the road. And so I think that COVID, and particularly the kind of the economic effects of COVID, is colliding with the long-term impacts of climate change to both increase drowning risk in our country and also to kind of strain the resources and mean that there's less funding, less investment in drowning prevention. So my next slide, I'd like to, so I realized that this has maybe been a bit of a pessimistic 10-minute presentation, but the WHO has called this year for us to do one thing to prevent drowning. And I think what I'd like to leave you with as the one thing is to try and think about how we can shift the thinking and the mindset around drowning. And I think often, you know, even within the spaces that I often work in, within lifesaving and sea rescue, and we tend to think about drowning in the sort of that top left picture of children drowning in swimming pools or at the beach. We think of pool covers and nets and fences and lifeguards as the solution. And I'm not saying that they aren't. In many cases, they are. But I think in more parts of the world, drowning doesn't look like that. You know, drowning looks like children bathing and washing in a river, and that river coming down in flood and washing out people that live on the floodplains. And so I think if we can think of one thing to do for World Drowning Prevention Day this year is to try and step out of our silos. So for those of us in the drowning prevention or injury prevention space is to think about how we can take drowning out of this kind of small bubble of drowning prevention and think about the intersection with other agendas, specifically those that have strong political backing. So we have to look at how drowning intersects with the Sustainable Development Goals, particularly 3, 6, and 13. I think we can find strong parallels there. And those that are not in the drowning prevention space, if you are here and kind of have come to this talk from a different injury space or a different sector, I'd like to encourage others to think about how drowning risk is actually part of, you know, what they do and what they address as well. So if you are working in the climate change space, to kind of, I encourage you to think about drowning prevention and drowning and what you can do, what one thing you can do in your space to actually bring drowning in and give it higher priority. Because even though it is perhaps smaller than some other agendas or some other issues, that doesn't mean, you know, for those 2.5 million people that have died from drowning over the last decade, it's still something very, very real and something very important. And I think we as a community need to make sure that we step out and try to highlight the issue of drowning and its parallels with other agendas. Thank you, Nibedita.
Thank you, Dr. Saunders. That's so reflective and critical. But I think there are a few takeaways for me. I just really like the way you brought the intersectionality of poverty, vulnerability, climate change, climate-related hazards. And also, I think it is so interesting because my understanding, a little bit of review that I have done last year, I thought that drowning is a rural phenomena. But I think from your findings, it is also an urban phenomena, you know, based on informal urbanization, lack of resources, and various other things. So I think the intersectionality is so key. And also your call to think outside the silos for the traditional epidemiologists and injury prevention is well taken. So thank you so much. Thank you so much. So our next speaker is another giant, absolute giant. It's an absolute pleasure to welcome Dr. Olive Kobusingye. Dr. Olive is an accident and emergency surgeon and injury epidemiologist. She is a senior research fellow at Makerere University School of Public Health in Uganda. She heads the Trauma, Injury and Disability Unit at Makerere. She is a distinguished fellow of the George Institute for Global Health, Australia. She is the board chair of the Road Traffic Injury Research Network, an international agency working to improve road safety. So it's an absolute pleasure to have Dr. Olive on board and give us her talk. So Dr. Olive, over to you.
Thank you very much, Nibedita, and it is a privilege for me to speak at this special session. And also to follow the two presenters that have spoken, because I think that what we are speaking to is going to be seen to be to come together. So I am speaking at drowning while at work. Has COVID-19 changed anything? And I think from listening to Colleen right now and hearing the very different type, different circumstances in which people drown, swimming pools and overflowing rivers. And then thinking about people that are drowning, maybe fetching water or swimming, and people at work. So if I could have the next slide, please. So I'm going to use an example from Uganda. In 2018, we concluded here a national survey on drowning. And our objectives were to try and get a handle on the burden of drowning, but also to have a good understanding of the circumstances in which people drown. So the results showed that boating is a very high risk, and that in fact 50% of those that drown in Uganda are engaged in boating, and that of those that are boating, close to 70% of them are fishing, and another 25% are traveling, quite often traveling as a part of trade on the water. And most of these would be young people, ages in their 20s and early 30s. And as you can see, they'd be using small vessels, rowboats, canoes, and maybe other small fishing and transportation boats. So this, one would say, is data that is specific to Uganda. If I could have the next slide, please. So this was before COVID-19. But the story that I'd like to tell this afternoon is from a specific part of Uganda. And as you can see, Uganda is well endowed with water, with large lakes, small lakes, plenty of rivers. But I'd like to focus on this part of Western Uganda around Lake Albert. Lake Albert is a beautiful crater lake that straddles the border between Democratic Republic of Congo on one side and Uganda on the other side. And so the communities that live around the lake and that live off the lake are on both sides of the border, and they actually would cross, back and forth without much regard to the imaginary line that separates the two countries. So these are mostly fishing communities that derive their livelihoods from the lake. Now, in early 2020, when the pandemic was declared, literally overnight, Uganda imposed a lockdown, a serious lockdown, public transportation shut down. Fishing on the lakes, fishing on this and other lakes was shut down initially for 30 days and it was extended. And in fact, between immigration, security services and public health, they forcibly moved communities that lived on the upper parts of the lake and brought them into the lower parts where they could presumably be more closely monitored. And this was also that they could protect the people from the virus, so that people that might be crossing over from the Congo into the Ugandan waters and onto the Ugandan shores might be prevented from mixing with the Ugandans, and so maybe not bringing the virus across. So literally overnight, these people that lived on the lake and that had their entire livelihoods on the lake lost their incomes, lost their sources of food. They were forcibly moved, so they didn't have any incomes and they didn't have any ways of acquiring food. So as we can see in the next slide, after a short while, we started getting these reports of increased drownings, boat capsizes on the lakes. And some of these were happening as people were being forced to move from one part of the lake to the other. But there was also something else happening, is that when you force people whose livelihoods depend on the lake, for instance, they're going to have to find some other way to survive. And so from having lost their livelihoods, a lot of property was drowned in the lake as people were trying to get away from enforcement services. We started to hear of other things. If I could see the next slide, please. So these communities that were escaping the virus were beginning to confront the lake in some other ways. So there was increased unregulated and illegal fishing, as you might imagine. Once those areas that were regularly fished and monitored by marine services, as they were being cleared of all legal fishing, the fishing community had to find some ways to survive. So they were then now finding alternatives, using more irregular vessels, improvising in some ways, and then fishing from areas that they knew to be unsafe, but they would be away from surveillance. They would be away from security surveillance. And as you might have noticed in my first slide, there's very little use of life jackets, but now even that little was gone, because the fishermen realized that if you have a life jacket on, then you attract attention from security. And so once the lockdowns were imposed and once all these regulations came into force, then the same people that were being protected from the virus were actually being forced to go into more unsafe use of the lake. And so we understood that there were some undocumented drownings, either little boats, improvisation, and they were capsizing, or people were using some other ways to try and get across the lake, and there were drownings. Now, this is a story from maybe from where most of you are, from a remote corner of Uganda, but actually this is not unique to Uganda. This happened in many other places where artisan fishing is happening, where communities that are dependent on rivers, on lakes for their livelihoods, those livelihoods were taken away by policies that were probably well-meaning, but not taking sufficient regard for the livelihoods of the people that rely on the water. So then we begin to think about, so if I could have the next slide, please. So some of you, all of you, I'm sure, will see 2030 Agenda for Sustainable Development and immediately recall the UN resolution that brought in the World Drowning Prevention Day. And in its first paragraph, it actually recalls, so that was UN resolution 75/273, and it uses the first paragraph to recall UN resolution 70/1, which was the resolution that articulated the Sustainable Development Goals. And in that paragraph, it talks about its recognition that eradicating poverty in all its forms and dimensions is the greatest global challenge, and its commitment to achieving sustainable development in its 3 dimensions, economic, social, and environmental, in a balanced and integrated manner, to building upon the achievements of the MDGs and seeking to address their unfinished business, and to leaving no one behind. So if we think about these communities, if we think about the example that I just gave of fishing communities that had lived on the Lake Albert, and that in a couple of days, you know, without regard for their economic, social, and environmental concerns, they were moved away from where, you know, from their living spaces. They were shut down in terms of livelihoods, of economy, of earnings. Then we realized that in some ways, that would not pass for what we would be saying, leaving no one behind. So I'd like to reflect on this and point out 2 things about drowning prevention. Is first of all, our dependence on local data if we are to make a difference. So for instance, listening to the, you know, the presentation from Bangladesh and realizing how very different it is from Uganda, is that if we want to make an impact in any place, we are going to rely on local data to know the right thing to do. And that if once we understand the circumstances in this location, then we'll be better able to deal with it. The second point that I'd like to reflect upon is the multi-sectoral impact. For instance, there was security, there was public health, there was immigration, there could have been education, and all of these, the policies that will come out of those sectors have a huge impact on whether people's risk of drowning increases or reduces. So I'd like to I guess, make the appeal that as we go into looking at different countries and how they approach drowning prevention, and realizing that we need all these multiple sectors. So we look at our policies and say, regardless of where the policy is coming from, let us pay attention to the economic, the social, and the environmental concerns of these communities. Otherwise, we won't be leaving them behind. We'll actually be leaving them dead in the water. Thank you very much.
Olive, thank you so much. Absolutely fascinating story. So I think the takeaways for me, I'm always fascinated by causes and circumstances of direct and indirect deaths. You know, so I think the numbers, the risks at risk population, the presentations that we have heard from Dr. Aminur, Dr. Collins, but I think your story is so profoundly human. And it is the story of the fishers and the fishermen's lives and livelihoods around the Lake Albert. And it's absolutely fascinating. And the other thing that you mentioned, which I have written down, is that about that we need to understand the circumstances, the local circumstances. It is the local circumstances will, in a way, generate innovative solutions. And it is through innovative solutions that are based on context-specific evidence, we will be able to identify solutions to reduce drowning. So drowning is an occupational hazard in the context of Uganda, which is so different what we heard from Colleen and Dr. Aminur. And finally, the multi-sectoral approach. So the drowning cross-cuts so many sectors, and governance is the heart of it. And governance is something that I have been working on for the past 10 years. So fascinating presentation, a different side of drowning as an occupational risk, occupational hazard, which brings health and safety, governance, multi-sector, and also sustainable development goals at the heart of injury prevention. Thank you so much, Dr. Olive. So finally, we have Judy. So it's again it's an absolute pleasure to invite Judy Omasete. I have worked with her for the Drowning Project, which was funded by Royal National Lifeboat Institution. So it's an absolute pleasure to introduce Judy. So Judy works for Norwich City Council as a community conversation officer, promoting community development and resilience. She is a WASH consultant and British Red Cross Norfolk Emergency Response volunteer. As I mentioned, that this project was funded by Royal National Lifeboat Institutions, and we have recently concluded this project. And I would like to invite Judy to present the findings of our project. So Judy, over to you. Lauren, do we have Judy? She was on. Judy is there. Yes. So Judy, the floor is yours. Is there a technical problem? Ah, there's a problem with the audio. We'll give a few more minutes, maybe a minute or two. So Judy, if you could. So Tom, what would you suggest? Shall we move on to the next one? And then once, okay, thank you so much. Okay, let us do that. So we'll bring our audience leaders. So Hideyuki will be introducing our junior leader and our future leader, and I'll resume my introduction to Judy later on. So Hideyuki, over to you. Thank you.
Okay, thank you very much. So we means ADN have done around 10 special sessions. It's difficult to how to count, but anyway, yeah, we have done more than 10 special sessions so far. But inviting our future leaders as a speaker is the first initiative, if I'm not wrong. So today's special session is one of our special sessions. So we have two future leaders today. So they are Arkoneil, Ghosh, and Racheal Nantume. So let me introduce the first speaker, Arkoneil. So Arko is a 13-year-old student from Mumbai, India. Attends Jannabai Narsi International School. He has been a junior champion with ADN since 2020 and has regularly contributing articles to raise awareness in society about sanitation, education, and pollution. He has been working as an intern, raising awareness about learning this since 2022. During this time, he researched the topic and conducted interviews with people from various countries around the world to better understand the risk of drowning death. He is a polyglot and an avid coder. He can think and communicate in English, Hindi, Bengali, Mandarin, Spanish, Marathi, and Japanese, though only at basic level, he said. When he is not studying, he enjoys reading detective and crime novels. He firmly believes that in order to change the world, one must first change one's attitudes. Okay, Alk, over to you.
Yes, hello everyone. Yeah. So this is my poster. So how can I prevent drowning deaths? 10 ways to prevent drowning deaths. Ms. Nibedita, should I read it out?
We can't hear you, Arko.
I should be reading it out, right?
Yeah.
Okay, so to prevent drowning deaths, we can firstly learn how to swim. So if you know how to swim, if drowning won't be a problem for you. And second, if you learn to swim, learn it under supervision, like do it with a teacher or an adult who can help you out. Third, learn about water safety, like how you can use life jackets or any important things you can help to prevent drowning. Learn to respect water and water safety. Fifth, do not hold your breath for too long underwater. Like you can maybe try water exercises, but do not try to hold it for too long. Like you can also sometimes catch the air outside. Six, do not swim in prohibited areas or in unfamiliar water bodies. So if there's a prohibited water body, do not go near it unless you have adult supervision. 7, of course, you should never go out swimming during floods. Like if it floods, do not go for swimming. Like you can skip swimming. 8, you can build fences and barriers around water bodies which can be close to your homes. If you were to build fences and barriers, you might not face any problems. 9, practice precaution when rafting or doing any kind of water sport. I personally also practice water safety because it's really important for you. And lastly, government-run primary schools should provide basic swimming skills to all children below 9 years of age. Because when I was reading the data of drowning deaths, children below the age of 10 years are really at a risk of drowning. So this must be mandatory for all kids, especially the government-run primary schools. Yeah, thank you.
Yes, thank you, Alko. Yeah, thank you very much for your contribution. I know the first version of your poster, so I could see the great improvement of poster. So thank you very much again for your great contribution to the session. Very much. Okay. Right. So yes, Nibedita, do you have any comment to Alko?
Yes, I do actually. I just want to give a little context about Orko's work. So Orko joined ADN last month during his summer holidays, and he didn't know anything about the drowning. As Hideyuki has mentioned that he loves reading, he's an avid reader. So the moment I told him about drowning, he was literally shocked, to find that the children below 5 years of age are at risk of drowning, and he read extensively. So basically, after reading some of the references which is in the poster, he developed this poster himself. We've just helped him to tidy it up. So he identified his 10 steps. So a big kudos to Arkoneil. So thank you very much, Arko.
Thank you.
Right. Okay. Thank you very much. Right. So let's move on to next feature leader. So next feature leader is Ms. Racheal Nantume. Her presentation is poster on policies and the program related to drowning prevention in Uganda. So Racheal is the trained civil engineer with experience in contact and project management, design, construction supervision, and maintenance of buildings, roads, bridge, and structure. Founded by the Commonwealth Scholarship Commission in the UK, she is passing her MSc in crisis and disaster management at the University of Leicester. Racheal's MSc dissertation project focuses on drowning risks in Uganda. So, Racheal, over to you.
Thank you very much for that wonderful introduction. Firstly, I would love to thank my supervisor and mentor, Dr. Nibedita Ray-Bennett. Special thanks to the Commonwealth Scholarship Commission that's funding my studies and therefore funding my research. And finally, I would love to thank my colleagues at ADN for all their support. Special mention to Mr. Alex Skinner, who proofread the poster, and Ms. Lauren McLeod, who designed this poster. So the poster is on avoiding drowning, injury, and deaths in Uganda through the Occupational Health and Safety Act 2006. And I'm glad to present after Dr. Olive Kobusingye, who has labored to explain the burden of drowning, especially among the fishing communities. A study by Dr. Olive showed that 39% of the deaths, drowning deaths that occur in Uganda are due to fishing, and that that drowning contributes to 502 deaths per 100,000 population annually. And today we've learned that when you take it down to drowning due to boating incidents, it has an even greater contribution to drowning deaths as a result of fishing. And recent studies on drowning prevention in Uganda have focused on preventing drowning by promoting water safety. But this research is focused on promoting occupational health and safety to prevent drowning. So we propose the promotion of a drowning prevention policy and also the enforcement of the Occupational Health and Safety Act as a means of preventing drowning. So some barriers to reducing drowning in Uganda, we lack a drowning prevention policy, and also we lack a multi-sectoral approach, as this has already been mentioned. And also there is lack of enforcement of the occupational safety and health measures. I've been privileged to do my data collection, and I've established that the occupational safety and health measures are not being enforced at the learning sites because of the complexities that surround the fishing community in Uganda. It's mainly informal. We have so many landing sites, and the registration captures the boat owners and not necessarily the fishermen who do the fishing. So this puts them at a great risk. So to overcome the barriers, we are proposing the enforcement of the Occupational Safety and Health Act, since there is no drowning prevention policy. Also the promotion of a multi-sectoral approach. As we've heard, there are many players, and to mention some, there's the Ministry of Labour, Gender and Social Development that is mandated to enforce the Occupational Safety and Health Act. We have the Ministry of Works and Transport that enforces water safety, that is water transport. We have also the Marine Police under the Ministry of Internal Affairs that is in charge of reducing deaths on the water. So we need a multi-sectoral approach. And the Department of Occupational Health and Safety should take on the lead role in enforcing this multi-sectoral approach. And back to the legislation, we have currently the Inland Water Transport Act, and this is being used to guide drowning prevention. However, this act, along with the Lake Victoria Transport Act and the Fishing Rules 2010, are designed to promote safe boating and not to reduce drowning deaths and injuries. So there's still a gap. And then the far right, we have a box that has cited out some clauses in the Uganda Occupational Safety and Health Act, and this can be used to promote drowning prevention and reduce drowning deaths and injury. And some of the clauses speak of providing a safe working environment. There's a duty of the employer to provide a safe working environment. The employer has a duty to promote, to provide personal protective equipment for the workers. The employer has a duty to inform workers and train them and instruct them on the work methods as a way of promoting safety. Also, it requires the employer to have a written statement policy on safety and to have safety committees, to have representatives, and to work with the employees in ensuring safety. Generally, the Occupational Safety and Health Act requires the employer to take the lead role in promoting health and safety. And this can only be effective if there's enforcement, and this enforcement can better be guided by a policy and also by leadership, which the Department of Occupational Health and Safety in the Ministry of Labour and Gender can provide. Thank you very much.
Thank you very much, Racheal, very much for your poster presentation. So I thought yeah, to be honest, Uganda is relatively safety from water-related, the hazards, as Uganda is landlocked country. But I changed my understanding today. So drowning in Uganda, in particular, workplace is big issue. Then the story in Uganda reminds me the story of 1983 earthquake in Japan. When that earthquake occurred, the tsunami came, and then more than 100 people, mainly from mountain area, killed by tsunami because they didn't know the risk of tsunami. So they went to the sea coast as a sightseeing, but they didn't know the tsunami risk. So that's why they died in 1983. So yeah, water safety is all people's business. Thank you very much for your presentation. So Nibedita, do you want to give some comment?
Yeah, I think Racheal is currently doing her projects. It's not done yet. She's just finished her data collection last week. So I'm hoping that we'll be able to find more interesting results once she does the cleaning and analysis. So all the best wishes to Racheal. So thank you very much, Racheal.
Right. Okay. So yeah, thank you very much to our future readers for you both a great presentation today. So thank you very much. So over to Nibedita.
Yes. Thank you very much, Aloy, for complimenting our future leaders. And Dr. Olive, I've also read your comment on the chat box. Yes, Arkoneil is very special. He joined ADN when he was 10 years of age and is becoming more active. So we are very privileged to have such a brilliant mind, young, fresh, and he has lots of dreams, yeah, lots of dreams to change the world. So we need dreamers to achieve such brilliant goals. So I hope, Judy, your speaker is working. So can we have you on the screen, please? And maybe try your mic a bit. We can't. So Judy, we can't hear you. Okay, so if that doesn't work out, so Tom, maybe we could probably do the Q&A. What do you think? What would you like to suggest the way forward? So
hello,
I invite.
can you hear me?
Oh, yeah, okay, brilliant, hooray! So we have Judy. So thank you very much, Judy. So please, the floor is yours. Give us your presentation.
Thank you.
Thank you.
So hello, everyone. Sorry about all the difficulties, but we are here. Thank you for the opportunity. I'd like to present on behalf of the RNLI, EMIDO, CIPRB, UEA Water Security Research Center, and University of Leicester. So I'll be talking about a project we completed in March this year on understanding the impact of climate change and drowning risk in Bangladesh and Tanzania. And I really appreciate that I'm speaking actually after Colleen, Dr. Rahman and Dr. Olive and Racheal, because that just ties up the research that we did. It just helps explain many things, actually, many issues. So just about RNLI, many people do not understand RNLI's drowning risk, are not aware of RNLI's drowning risk reduction programs outside the UK. And so it was interesting to be able to research the Bangladesh, their Bangladesh risk reduction, which is luckily Dr. Rahman has spoken about Bangladesh. And this is the community daycare for preschool children, survival swimming lessons for school-age children, and rescue and response training for key adults in communities. And in Tanzania, it's lifeboating training for fishers, co-designing buoyancy products and strengthening fishers governance to include occupational safety. Due to the high incidence of drowning in specific populations in these countries, the project sought to understand how climate change might impact on RNLI's programs between now and 2040. Please just put the other, go back one slide, please. So we examined data from literature reviews, informal discussions with in-country experts, including WaterAid Tanzania, and secondary data analysis to examine the interaction of the project implications of climate change with other risk dynamics. However, there are limitations in the projections for climate modeling. As you can imagine, it's very difficult to get the exact information. It's usually just regional information. Next slide, please. Next slide, please. As you can see, oh, sorry, one back, please. Yeah. As you can see by the show of upward arrows, both Bangladesh and Tanzania show significant climate changes by 2040, increases in average temperatures, high intensity rainfall events, human exposure to river and coastal floods, and to intense cyclones is likely and possible in both countries. In Bangladesh, displacement from low-lying areas likely in the south due to sea level rise, a twofold increase in disaster-induced displacements. This is based on figures for 2010 to 2018. And also a five-fold increase in disaster-induced displacements for Tanzania. This is based on figures for 2014 to 2019. Next slide, please. So we used a table of key drowning risk factors. We looked at using an interactive workshop to categorize risk factors into broad themes, and qualitatively evaluated the likelihood of risk factors to increase and their consequences for drowning. So on the screen here, you can see the red color indicates factors we considered very likely or almost certain to increase and which have high consequences for drowning. So you can see here, living in proximity to water, extreme weather events, children under 5 years old, lack of supervision, and also population growth and migration and displacement is likely to cause high drowning risk factors. Next slide, please. So the qualitative exercise using these risk assessment matrices aided the discussion of relative importance of climate change effects on drowning risks and program activities prior to, during, and after a workshop with RNLI staff and other experts. So through this process of independent research and expert elicitation, the team offered a set summary of connections between climate change and drowning risk factors. Those considered most significant are shown here in the proximal risk factors, intermediate, and contextual risk factors. So I'll just focus on the lack of supervision for young children, just because of the time we have. So climate change is very likely to increase stress in low-income families by exacerbating livelihood insecurities, and this increases their working hours and increasing illnesses, injury and deaths from poor safety or work practices. So combined with extreme weather events, any of these factors may reduce parental capacity to supervise young children and protect them from drowning risks. Next slide, please. So in conclusion to our findings, climate change should be factored into drowning risk reduction policies and interventions in both countries. So the rationale for RNLI and their in-country partners projects needs to continue, and impacts on some additional groups should be monitored. And also we also recommended a multi-sectorial holistic approach. Just to give an example, just to build on what Racheal said, we saw that the fishing community, for example, there was a situation where alcohol was provided by the boat owners to give courage to the fishermen to go and swim in very rough waters. So in that case, also we found that there was no facilities for people to, banking facilities. So it's just a recipe for if they have their cash with them and there's no banking facilities. And also the fishermen also had the dependents, each fisherman had about 8 dependents each. So this means that they have pressure to go fishing in very dangerous conditions. So this shows that it needs a holistic approach, and it just backs what all the speakers have said today. So thank you very much for this time.
Judy, thank you very much. I think nicely, it's fitting, nicely summarized what we have heard throughout the session. So it's now our last speaker. It's an absolute pleasure to once again engage with Royal National Lifeboat Institution. So on behalf of RNLI, Royal National Lifeboat Institution, we have Tom. So Tom Makerere is the Senior International Evidence Manager at the RNLI, where he leads a small team focused on understanding the drivers for drowning and evaluating interventions. He has worked extensively on drowning prevention programs for nearly 15 years in East Africa and Southeast Asia, and has a particular interest in ways to adopt interventions for different cultural and social groups. So Tom, over to you. Thank you very much for joining.
Oh, thank you so much. It's lovely to be here and to reconnect with old friends, and also to be able to share the issue with others who may not have been working on drowning previously. So if you go to the next slide, I'm just going to give a kind of a brief summary really of some of the key points that I thought I would take from the presentation, because I saw the slides but I didn't hear the talks previously, and there's some lovely new things that I've learned as well listening to the talk. So I think it's just, I think just reflecting what people say, I think, it's really important for us to remember, as Colleen was saying, that, most drowning deaths do occur in low income and low resource settings, where people are exposed to water for these essential daily activities, whether that's, washing themselves, collecting water, or for livelihoods or just transportation. And we know that this exposure to water is shaped by, a number of different factors that are predominantly kind of the local kind of natural and built environment, but also due to necessity. Next slide, please. It's a bit slow on my computer. So, so in Southeast Asia, we heard from Amin that, there's ponds and there's rivers throughout countries like Bangladesh, and that exposure to water and the risk of falling into water, and because of that is actually almost constant. There's water everywhere. But Olive reminded us that the risk of drowning and those risks that people are undertaking and the built environment are very localized. We know that a key driver of exposure is poverty. Whether that's because of a lack of adequate piped household water, or the necessity to travel during kind of risky weather conditions, maybe to, you know, as Olive was saying, you know, catch enough fish to get an income, or because you need to have a wash. But, you know, as all the speakers highlighted, you know, these issues are compounded by kind of social, political, and environmental externalities as well. And Dr. Amin, you know, highlighted the importance of childhood supervision in Bangladesh and the evidence base around that. And we know, though, you know, that throughout the kind of you're touching on the COVID-19 pandemic, we've seen that child supervision structures, you know, around the world have been dismantled to some extent, as schools and nurseries have been closed due to policy decisions to reduce infections. And, you know, we have emerging evidence that's suggesting that these closures have led to a spike in drowning cases in a number of countries, both, you know, both probably due to the lack of supervision of children in environments with a lot of water, but also due to an increase in exposure as people are looking for outdoor leisure activities that also kind of come with a low risk of transmission. And Olive also, you know, was remind us that taught us actually that the displacement caused by COVID-19 has also had, you know, an impact on people's exposure to drowning risk around the lakeside communities of Uganda as a good example, where people are forced really to use more dangerous parts of the lake for their livelihoods and for transportation. And I think it's important. It wasn't touched upon so much, you know, by the speakers today, but you know, there's been a lot of talk as well about the impact of COVID-19 on the health system as a whole. And we mustn't forget that in the early days, in particular of the pandemic, many organisations that have been responsible for the rescue and resuscitation of drowned people, they stopped doing so in many cases because they were worried about the safety of staff and volunteers. And this is likely to have a long-term impact on you know, the timely and then the necessary timely provision of ventilations, air, oxygen for drowning victims, as rescuers will probably remain hesitant about the risk of cross-infection due to COVID-19 and other airborne viruses. And next slide, please. And then there's climate change. You know, we've spoken about it today, and we know that it's we've been talking about it for some time, but we haven't really kind of understood or really thought about the implications on drowning risk. You know, research from some high-income countries suggests that interactions with water are likely to increase quite significantly with hotter temperatures. We know that drowning is likely to be the injury type most affected by increasing temperatures, and research from Canada suggests that temperatures exceeding 30 degrees in Canada at least were associated with a 69% increase in drowning deaths. And we know that drowning is the leading cause of death during floods and cyclones, and although you know, there's uncertainty around the distribution of floods and cyclones and you know, other disasters. We do know that their frequency is going to increase, the intensity is going to increase, the severity is going to increase, and that's also likely, because drowning is the leading cause of death, going to increase in drowning risk. And we also know that those events disproportionately affect women and children. Again, Olive kind of touched on displacement and the need for people to kind of continue their livelihoods, and despite these changing externalities. And we know that, you know, declining fish stocks, our recent work on Lake Victoria in Tanzania has shown that depleting fish stocks are pushing fishers to continue their fishing, but in more dangerous areas of the lake, undertaking it in more during more dangerous weather conditions. And because they're taking greater risks to get these fish, there's also this temptation to overload boats, which again increases the risk of drowning through capsize. And I think, finally, I think, Julie has spoken about the effects of climate change on displacement of people, and Colleen talked about urbanization. We know that displacement due to climate change is likely to lead to an increase in urbanization. But as we were talking about before, we don't really understand how that's going to change people's drowning risks. And we know that people in urban areas, drowning risk is more focused on storage of water in water containers within the home, within drowning at construction sites, and drowning in things like drainage canals and sewer systems. But we need to understand these drowning risks better, and we understand interventions to address them. Not least because also population levels are increasing, and the numbers of people within those environments are going to increase, regardless of whether climate change takes place or not. So finally, last slide. The WHO have produced these 10 actions to prevent drowning. And, I was just reflecting when I was looking at the presentations and, thinking about the WHO's recommendations, how do we best engage other sectors to integrate drowning prevention measures? We've mentioned it a number of times already today about the need for kind of multi-sectoral action. And then secondly, we've also spoken about interventions, and the WHO's recommended interventions around survival swimming and supervision and so on are there. But, are these interventions as they currently stand, are they suitable for a changing environment? Or do we need to think outside of the box when it comes to how we deal with drowning in the future? So thank you. Those were some of my reflections, I think, on, as I say, what I thought was going to be spoken about by the speakers. And as always, I've learned more just by listening to them. So thank you.
Thank you, Tom, for wrapping it up. So what we will do now, we will just open the floor to the audience. If they have any questions, they can ask. So I've seen there's a question for Dr. Colleen, and it also probably is also for Dr. Olive. So it's from Tony Moore. I hope you've had the chance to read that question. So Colleen, would you like to answer that question? And then I'll go to Dr. Olive as well.
Sure. Thank you. I'm just going to read the question, I think,
yes,
for the benefits of everyone else. So Tony says, not sure why transportation accidents on water are excluded, as suggested by myself. Olive spoke about small boating accidents. Something like 1,400 people died in ferry accidents in 2021, and most of them will have drowned. So I think, Tony, it really depends on the data source and why, different data sets around drowning tell us different things and give us closer to a complete picture or not. I've posted an article in the chat by Amy Peden and Richard Franklin and others that looked at kind of a data set, and if you just use ICD-10 coding, which forces you to choose one cause of death, it underestimates drowning deaths by, I think it accounts for about 60% of the total drowning deaths. And so I think it really depends on the data source that you're using and for what purpose it was collected. So when we're using national kind of, in South Africa, our data mostly comes from the Statistics South Africa, which is looking at national causes of death, and they use ICD-10. So then we are kind of restricted by what people choose as the singular cause of death. And in that case, it often doesn't account for things like transport-related deaths, and particularly things like flooding. So often those tend to end up in other ICD-10 codes. And it may be different you know, Olive, I think, could speak to this, but it depends. If you have a data set that's specifically trying to look at drowning, that you've gone and collected data, you know, on a particular purpose, you may have more of a complete picture, like Olive was able to get. I hope that answers the question.
Thank you very much. So Dr. Olive, would you like to comment?
Sure, thank you. So my response would be much different from what Colleen has said. That discussion has been on for some time to change this, because clearly it is it underestimates, it seriously underestimates the size of the problem, and gives reassurances where there should be none. But I also think that it has to do with, and this might, I don't know how this might come across, but I think it has to do with how life is valued in certain settings. So for instance, when you think about the definition of drowning, and you think about the areas in which drowning would have, data would have been traditionally collected on drowning, you would realize that there's very little chance that fishermen on some remote lake in Uganda would be under any form of surveillance, and that deaths in that community would come up on global data. I think that in injury surveillance, we've not been as good at going after the data in certain settings, and that our definitions have then tended to go with what has been easy to collect and what has been easy to define. And I think we need to broaden these definitions and acknowledge that, for instance, floods, you know, huge numbers of lives are lost every year due to flooding, and they don't get into a data set for drowning, but lake transportation as well. So I think these are things that need to change, and the UN resolution does acknowledge that. It does mention specifically that those two types are not being included, and that going forward, we should be improving our data by including them.
Yeah, thank you very much, Dr. Olive. I think I would like to invite Tom. We've had this discussion, didn't we? I think RNLI had a little bit of an experience with regard to ICD-10 and the causes and circumstances, and the challenges of not getting the drowning picture properly. So over to you, Tom. So it would be brilliant to hear RNLI's perspective as well.
I mean, yeah, I'm sat here with Olive and Colleen, and they're super experts in this field. But one of the challenges that we've faced, like everybody else, is understanding these numbers. And we've just done some work in Tanzania where we were reviewing verbal autopsy data, for example. And one of the challenges that we're finding is that although drowning is a relatively easy thing to identify as a cause of death, actually the data that's collected within verbal autopsy around the drowning incident isn't particularly useful for understanding the circumstances of the incident, and therefore kind of what to do about it and how to prevent it. So we've been doing some work with our local colleagues at the Ifakara Health Institute to review all the verbal autopsy narratives around their data sets from their health and demographic surveillance sites, and we're finding that actually we're not able to say much about the circumstances of those drowning deaths. But if you look at the guidelines that are given by the World Health Organization for verbal autopsy, there's quite a lot of detail in there for communicable disease, and a few good questions for road traffic, but there's absolutely nothing at all for drowning. So our thinking, at least, and we've been talking about it, is there is a need, I think, for better guidance for data collectors, enumerators, to ask the right questions when it comes to drowning incidents, so that we can talk about them confidently and understand whether it's a drowning incident that's been caused by a fishing boat capsize, or whether it's because somebody's fallen into water. And as the other presenters have spoken about, and Olive highlighted, this is a really kind of a localized drowning is a localized problem, and there's not going to be any 2 drowning deaths that are the same. So for us to develop appropriate solutions, we really need the data, and that, I feel, is the challenge, and I think it requires all of us to kind of come together and say, well, we want better data, but what data do we want? Like, what kind of questions do we want to answer? Because, to be honest, like, we know now that in lakeside communities, in low resource settings, and drowning, and in communities living by water in Southeast Asia and other places, we know that their drowning rates are super high. We know that, but what we don't know is the circumstances around those deaths. So that's kind of the next challenge, I think.
Thank you very much, Tom. This Racheal Roland, you left a comment. Is it something that you would like to, don't know, agree with the speakers, what they have said, or is it something that you want to highlight? And probably you could unmute and tell us a bit, because I can't see any more questions, but I can just see your statement.
Hi, everyone.
Thank you.
Here. Yeah, really happy to be here. No, I'm really delighted to have heard all the speakers today and recognise, obviously, I'm working on occupational drowning in Tanzania, or drowning prevention in Tanzania, and I'm very interested to hear from you, Colleen, and obviously great to hear from Olive and others, and Judy, etc., on what's happening in occupational drowning. But I do think it's really important to recognise, and it's a really clear message that, Tom, you brought out to say that, temperature increase, if you're going to look at avoidable deaths and avoidable injuries, then drowning will be the number one. And I don't think that the public outside this virtual room probably has coined that phrase yet or recognises it. So that's one of the takeaways from today. I also just wanted to say how great it was to hear from Arkoneil and other Racheal, my namesake, on the work that you're doing, and look forward to supporting you more in the future. Thanks.
Thank you, Racheal. It's lovely to see you. There's a comment from Mitch. So Mitch, would you like to unmute and probably just express yourself? It's not a question, but probably a statement. There's something behind it. So please speak. That would be lovely.
I don't think Mitch is still with us.
Is it not there? Okay, so if there are any further questions for the panel, please feel free to post it or unmute.
Maybe if I could jump in, we often, and I think it may have come up in some spaces, but we often think about climate change, we think about the increasing temperatures, extreme weather events, and flooding. But I think people often forget about the risk of drowning that's associated with drought as well. And as we move into drier climates, we saw here in Cape Town, we had quite a severe water shortage, a drought over the last few years. We seem to have come through the other end of it now, but we actually saw, surprisingly, even though swimming pools were closed and because they couldn't fill the municipal pools and things, we did see a change in the profile of drowning as people start to store more water. We had quite a big campaign to save water within the city and store your own water, store rainwater, reuse water for different things. And we unfortunately had quite a few publicized events of small toddlers drowning in water that was being kept in buckets to save water and use in your garden, and rainwater storage. And so I often think droughts, rather counterintuitively, are forgotten about as a climate change issue that's also going to lead to more drowning or different drowning.
Brilliant. So Tom, would you like to comment? Please?
Yeah, no, I think Colleen's right. I mean, Colleen's right, and I think it comes back to what Colleen was talking about, and what I was trying to emphasize before is around urban drowning deaths, and we're likely to see an increase in urban drowning deaths, not least because of climate change, but as Colleen says, because people are moving to cities and urban areas because of climate change, because population levels are increasing, anyway, in many countries, and but also, as Colleen said, that kind of confounded in many places by drought and the need to store water. It's going to be really interesting and really important for us as kind of practitioners to understand what to do to stop that from happening, and not to stop them from collecting water and storing it, but to stop people from drowning in it.
Judy has raised her hand, but just to add to Tom and Colleen, is it possible that maybe information, education and communication materials could help in terms of raising awareness and understanding around storing water at home in the places where drought is widespread?
I do think so. I mean, the whole campaign around our drought, there was a communication campaign around saving water, which was successful. I think, we were quite surprised how Cape Town pulled together to keep us away from the day zero that we were predicting. And that was purely a communication strategy. I think that perhaps there could have been included in, and this is a good example perhaps of the need for incorporating drowning prevention into other sectors. So if someone had just included some messages around water safety and how to store your water safely, keep lids on buckets, things like that, maybe those things would have been prevented, those incidents. So I do think there is some scope for education and awareness, but I do think that we, as a drowning prevention field, also need to be careful of relying too heavily on communication strategies and just water safety education, and actually start looking at clear interventions as well. On messaging.
Thank you. Judy, you have raised your hand.
Yes, I just wanted to add on the drought, how drought affects. In this study, we found that people who were affected by drought, they couldn't grow their crops, and so they moved towards the lake, and starting a new occupation of fishing, they have less awareness of how the lake works because they haven't lived in the lake. And also we found that because of drought, some people decided to cut down trees for charcoal, and that's as a new livelihood. And so when the rains come again and all the soil, there's soil erosion, and that causes worse situations. So I'm just trying to show that drought as well has an effect on drowning. Thank you.
Sorry. Yeah, so I think as well, I think I think perhaps I'm when I was doing my presentation, I was saying that countries with a lot of water have very high risk of drowning, rates of drowning, and that's true. But also countries, very dry countries, have big challenges with drowning deaths. And I think it's it's easy, as Colleen was saying, for us to think it's kind of paradoxical that communities in dry countries don't live in the desert. They live around water bodies. So I run a program in Sudan, and very high rates of drowning within lakes, riverside communities. It's a very dry country. People always say, well, why are you doing drowning prevention in Sudan? Well, people don't live in the desert. They live next to the river. So I think it's just people remembering that these are interactions with water that we all undertake on a daily basis, whether that's for washing, brushing our teeth, having a shower, and whatever it is. These are daily activities that nearly everybody has to undertake, whether you're in in a very dry country such as Sudan or a very wet country such as Bangladesh. So I think it's you know, again, as Colleen was saying, changing people's kind of mindset as to how we think about drowning. And this is an issue that is there all the time because we have to use water for, you know, out of necessity. So it's just that we're very lucky in high income countries to have our water coming out of a tap and not having to collect it from the river or from a pond or from a well. So yeah.
This is fantastic. Yes, change in mindset, but also maybe there's an opportunity for WHO to listen. That drought can also drown people. So thank you so much, everybody. So Hideyuki, I would like to invite you once again to run the second and the last poll and then conclude the ceremony. So thank you to all the expert panel, the brilliant questions, and thanks for listening to us. So Hideyuki, over to you.
Okay, thank you very much. Let me run the second poll. Yes, now you can participate. Oh. All right, okay. Okay, now. Now the response rate is 61%. Wait for a while. Percent. %. Okay, so the first poll was the response rate was 71%. So yeah, now it's reached 75%. Okay, enough. Yeah, thank you very much for your participation. Okay, all right. Pause. Okay. Let me share the results. Right, so the ratio of very confident was just 10% at the first poll, but now rise to 56%. So we are very grateful for this result. So the result, the detail of the result will be shared on ADL's website later. So you can access the recording of today's session as well. Okay, thank you very much. Right. Okay. Right. So closing, yes. So first of all, on behalf of entire ADN team, I would like to express very big thanks to the speakers and the future leaders for the great talk today. So I really enjoyed and learned lots from the talks. I believe that this special session definitely one thing down for drowning prevention. Thank you very much. So, right. Although ADN's main target is low and middle income countries, drowning is the issue not only for these countries, but also high income countries. Due to my knowledge limitation, I am taking school safety in Japan as an example. So we have lots of drowning deaths of children in Japan as well. The situation is very similar to Bangladesh. So school-age children are died due to drowning in river, pond, or the sea. So preventing drowning is one of the big issues for school safety. As our future leader, Arko suggested, learning how to swim in school is one of the compulsory topics in Japan. So in addition, some schools teach swimming free closed for all grades. So they learn how difficult to swim in free closed and how to save their lives using non-special items such as plastic bottles and plastic bags. they learn how to use these as a float. So I believe giving this kind of lesson to all grade children is really useful. So during summer break, every year, several children in Japan die due to drawing. I want to share the idea which I learned from today's session with schools. So again, I would like to express my great gratitude to all of the participants, and I want to thank the entire ADN team for their hard work for the event realized. So lastly, let me make an important announcement. So our next special session is International Snakebite Awareness Day, which will take place on the 19th September 2020. So please kindly save the date, 19th September 2022. So the session will be held in hybrid format in collaboration with the Leicester State Volunteer and Social Workers Association. The session will be organized in collaboration with ADN Regional Coordinator, Dr. Madhurika Sahu and Mr. Dilip Patnaik, ADM Hub in India Advisor, Ms. Nimisha Goswami, and ADN India Advisor, Dr. Ambika Prasad Nanda and Mr. Mikhil Bahas, and the Indian Council of Medical Research, Bhubaneswar, sorry, my pronunciation. So if you would like to be informed, please kindly join ADN. It is free of charge. Don't worry, we won't send any spams. So thank you very much for today. So see you again in September. Thank you.